Well, thank you, Wenqing, and good morning, good afternoon, and good evening, all. As you just heard, what I want to do is try and put into perspective some of the aspects of H5 that we've just heard from Dr. Fouchier, and put it into the context of what that's done to human risk of these viruses. But first, I want to take a little bit of a step back and consider sort of what's been going on in the last couple of years in terms of zoonotic influenza virus infection. And here's just a sort of a very, very high level summary of what that looks like. And we've seen human infections with the usual H5s, which we'll talk more about, H9N2s, some new viruses, some H10, some H3 and 8, all of these from avian sources, and also swine viruses, so influenza viruses that are normally in swine, sporadically infecting humans, and we've seen those across the globe as well. So you can see a range of different viruses in different situations in different countries. And so one may ask, well, with all this activity, how do you assess the relative risk of some of these viruses for human health? And sort of as part of that toolbox to do that, the World Health Organization, as part of their global influenza strategy, has a tool for influenza pandemic risk assessment, or TIPRA. This is a risk assessment tool that is really designed to support a timely and updated hazard risk assessment that document the risk features of a particular zoonotic virus, identify knowledge gaps on that virus, so what do we need to know to get better grasp on the risks, and also to facilitate information sharing between different experts, between different organizations, between people with different skill sets. This particular tool was based on the US CDC's IRAT tool, but does have some important differences and has been updated once. And so what exactly is this tool, or how does it work, maybe? And the way this works is that it convenes subject matter experts, and it convenes subject matter experts who are experts in a range of different fields, from public health, animal health to virology. These experts are asked to score a particular virus based on a scoring algorithm on a number of different elements, and these are elements that are perceived to be important for assessing the risk of an animal virus for humans. And you can see some of these include human infections, how many human infections have been, what disease severity, when there has been infections, what level of population immunity in humans, and also how widespread the virus is. So clearly exposure to the virus is a big mediator of risk, and then some virologic properties. So virologic properties that we know are important for the switch of a virus, one day being, for example, a chicken virus, the next day being a human virus. And so experts come in, they're given a summary of what's known about the particular virus, they score, and what comes out of the other end of that, I'm skipping over a lot of details here, but is essentially a position of a given virus, and the given virus is represented here by black dots, on two scales. One is the likelihood, so what is the likelihood that that given virus will emerge in the human population? And the other is impact, so should that virus emerge in the human population, what is the likely impact? And they sort of go into more or less arbitrary numbers from 1 to 10, going from lower risk to higher risk. This here is a summary of the viruses that have recently been run through the TIPRA, had TIPRA analyses done on them. I'll draw your attention to the bottom left-hand quadrant here, and this is actually the clade 2344B viruses. These viruses were actually evaluated, so the H5N8 viruses, evaluated in 2021. At that particular time, as you can see, they were deemed to be of relatively lower risk to humans than many of these other zoonotic influenza viruses that we also trace, whether that be H7N9, H9N2s, or also some of the viruses circulating in swine as well. So again, at that time, considered to be at least of relative risk. The TIPRA doesn't give an absolute risk or doesn't predict pandemics, but allows this comparison of risk to be made. If we look at the individual risk elements that were scored for that virus at that time and their mean point estimates, you'll see some scored relatively high risk, particularly population immunity, but others very, very low. So receptor binding, susceptibility to antivirals. I'll also point out here that human infection. So human infection is a big driver of the score for likelihood. So these elements are actually weighted in the final calculation. And because at 2021 there hadn't been a lot of human cases with these viruses relative to how much virus was in animals, that were again a major reason I think that virus ended up perceived to be of lower risk. So now I want to ask the question of what has changed, and clearly things have changed with the 2344B H5 viruses since early to mid 2021. And I want to go over some of those, and these are just my own thoughts on TIPRA elements that I think have changed from 2021. And we'll go over these: genomic characteristics, infections in animals, geographic distribution in animals, and also human infections. So let's start with the human infections. What have we seen over the past couple of years with these 2344B viruses? We've seen human cases in a number of human cases or detections in a small number of individuals, but they are scattered in different countries. Most of the infections have been in China, the majority with the H5N6 form of these 2344Bs, keeping in mind it is the N1 form that is most globally dominant right now. A number of human cases. Some of these people, particularly I'll point out the cases from the US, the cases from Spain, were in people that were involved in depopulation of infected flocks, so very, very close contact. But still, overall, still relatively low numbers of human infections considering the scope of infected animals. And the scope of infected animals here, this is from 2021. At that time, when the first TIPRA was done, there were 49 countries and territories reporting 2344B activity in bird populations, primarily through Asia, Europe, some countries in Africa. Let's jump to now, and we've heard Dr. Fouchier talk about this, but in 2023, and I apologize for the different formats here, but we've seen maintenance of the virus in Europe, Asia, many parts of Africa, probably establishment as endemic status in Europe, but now also, of course, movement to the Americas. So 2021 to 2023, I think that the biggest change in this, at least in distribution, is that this virus is now in most parts of the globe, including North, Central, and South America. We're also seeing more different hosts filled with influenza, and that includes some hosts we know can be infected with influenza, such as these sort of scavenging mammal hosts who probably feed on an infected bird and get sick that way. We don't think they probably transmit too much, but many more of these are occurring, and probably due to the increase of infected birds around. But we're also seeing some hosts that we didn't actually consider of hosts of influenza before. I think that the porpoise and dolphin infections, there have been a small number of these detected to date. Prior to this outbreak, I don't think we really considered these guys as hosts of influenza. So certainly the number and the types of animals that are getting infected has changed. Most of those, I think, are sporadic infections, so one-offs, but we're also maybe seeing this virus setting up maintenance within new hosts as well. And this is a picture provided to me by Dave Stortlinger and Rebecca Paulson from University of Georgia here in the US. This is from buzzards along a river in Georgia. And it does appear, if you start to look at some of the viruses coming out of some of these scavenging bird species, buzzards, particularly vultures, that the virus may be now actually being maintained in these populations. And these are populations we haven't historically considered to be maintenance hosts of flu. maybe they're being maintained essentially because when one of them die, then others of the same species feed on that bird, and you get this cycle. I'll also point out of this picture, of course, humans. So this does, of course, cause a lot of damage for the bird population, but it also introduces these new interfaces, so new opportunities for these virus to at least expose themselves to the human host as well. So lots of things that have changed. Genomic characteristics wise, I'll go this very quickly. Ron has talked a lot about this. So we are seeing some of these polymerase mutations that we know are associated with adaptation of avian viruses to the mammalian host cells. As Ron mentioned, most of these are in the in the mammalian hosts that have been infected with these viruses. Seen some changes in neuraminidase, some changes in HA. So probably an increase in the number of these mammalian genetic markers in these viruses since 2021. But we do need to put that into perspective that, in terms of the whole soup of viruses, 2344B virus that are circulating now in birds with sporadic infection in mammals, most of these molecular markers are retaining the avian signatures. One point I again want to mention here is that one thing I mentioned was that a key output from a TIPRA is identification of knowledge gaps and really a roadmap for what we should be doing to get additional data that really increases our confidence in these risk assessment scores. The first four here are actually, I drew from the report from the 2021 2344B TIPRA run, because I think they're still very, very valid now. One is the genomic characteristics. We know some of these molecular markers that are associated with increased zoonotic risk. We need a better representation of sequences of viruses from around the globe, so from different places, from different host species, particularly anytime these are getting into either an unusual host or mammalian host as well. I think it's more likely that some of these key changes are going to occur when these viruses replicate in a mammalian host versus an avian host. But certainly we need more representation of sequences so we can, if there are important patterns starting to emerge, we can identify them early. Receptor binding, this is a key change, again, which Ron alluded to, but the influenza virus has to change its preference for the receptor it binds to upon this transition from particularly being an avian virus to being a human virus. We have some of the molecular markers are associated with that, but we really need to increase the number of viruses that are being tested for this receptor change, because at least in my opinion, this is going to be the key factor in transition of this virus, the 2344Bs, from an avian to a human virus. So we need to understand a little bit more what the current properties are these viruses are, what happens when they go into a mammalian host, what happens when they go into another host. So more actually laboratory in vitro work is needed there. We also need to increase our studies of the transmission of these viruses in animal models. The laboratory animal model that is used most widely to infer risk to humans, transmission risk in humans, is the ferret model. There have been a small number of these 2344Bs put through those models, but we need more. We need to understand what the transmission potential these viruses have. We need different viruses done. We need the same viruses done in different labs to get more confidence in that. We need to understand a little bit more about how much immunity humans actually have to these viruses. Clearly the hemagglutinin mediated immunity, there isn't much neutralizing, but the H5N1 shares a neuraminidase to the human H1N1 viruses. They're different N1s, but again, it can be anticipated there's some cross-reactivity immunity. We don't know what impact that has, so we need some more studies to really understand that if this virus starts to gain the ability to replicate in humans, what immunity do we have to it? And this one here is a new one I put in. Again, Ron mentioned it briefly, but the infection in animals, I think we're about to see a lot more push to increase poultry vaccination in countries that aren't doing it now. We really need to understand what that does to risk to humans. At least theoretically, if it does reduce the burden of virus in some of these interface animal species, it could go a long way to reduce the risk for humans. So to summarize, excuse me, the 2344B viruses are the dominant form of H5 viruses globally. There are some other pockets in some countries of other clades of this virus, but this is the major one. In terms of risk to humans, these are still very much bird viruses, so their risk to human health in their current form is low. Yeah, but while it's low, we've also got to keep in mind that the contact of humans to this particular version of the H5N1 virus is as high as it's ever been. It's in many, many different countries, many, many different species. So risk is low, but the opportunity is there for adaptation to take place. And this virus, as we've been over, is exploring novel niches. So this risk is not going to remain static. As this virus does different things, that is going to influence the risk to human health. So low now, but that could change. And that's why we need to monitor, and there's actually going to be another TIPRA analysis of these viruses in the very, very near future. So with that, I'll stop. I want to thank certainly the GISRIS platform and the TIPRA subject matter experts who really generated much of that data that I've just been over. And again, thank you all for listening.